So AL amyloidosis is associated with significant morbidity, and with advanced cardiac involvement, there is a significant mortality even with current treatments. And the ASH Society convened a body of experts to create diagnostic guidelines for systemic amyloidosis. But early on in the stage of us doing these diagnostic guidelines, we realized that there's still a gap, a knowledge gap among clinicians in general about when should we even suspect a diagnosis of systemic amyloidosis. And so we asked the question, what are the signs and symptoms that should prompt one to investigate or go down the diagnostic pathway for systemic amyloidosis? And so we conducted a scoping review to answer this question. Now, what is a scoping review? It's not just a review of the literature, but it actually allows us to map all of the existing literature and identify gaps in knowledge and gaps in that whatever area that you're looking at. And so we rigorously undertook a scoping review. We looked at all of the peer-reviewed databases. We looked at gray literature. We reviewed over 500 citations. And after going through exclusions and looking at what met our exclusion criteria, we ultimately were left with 117 articles and 9 peer-reviewed sites. And so with that, we actually found really interesting things about the different types of amyloidosis. I should have said that we did not only just look at AL, but we looked at ATTR wild type and variant amyloidosis. And so we discovered that, number one, hematologists are actually the last stop. Patients are not entering through a hematology pathway, and I think that probably is part of why the diagnosis of amyloidosis is so delayed. And so that we mapped out the different pathways through which patients presented. But number two, we discovered that there are clear patterns in the early signs and symptoms of amyloidosis, which are actually very vague: fatigue, weight loss, and of course cardiac symptoms. But these are really quite distinct from TTR wild type amyloid and variant amyloid. And we also distinguish the most frequent signs for AL amyloidosis. And so ultimately, with mapping these out, we were able to create these symptom clusters that could help physicians, clinicians at large, and not just hematologists, identify what can we do or what can we look for that would trigger suspicion for systemic amyloidosis early. So where do we go from here now that we have mapped out these various signs and symptoms? Number one, we actually have to create better infographics and educational material, not the traditional what has already been done, but actually with what we've mapped out to cue clinicians in earlier into what you should actually be looking for. Yes, it's vague, but we still need to be looking out for it to avoid delayed diagnosis and the consequences of that. But number two, actually, AI is really the future here. And I think involving AI actively and using symptom clustering algorithms or natural language processing algorithms to integrate patients' symptoms over time together with what we've mapped out for symptom clusters for amyloid can help bring to recognition patients quite early on rather than having delayed diagnoses as we have now. So I think that's going to be a great start to the presentation.